Hi there. My name is Victoria Lay. I am currently in the master's program at Mount Mercy University. Today we are going to be talking about Nola Pender's health promotion model. The objectives that we will go over are number one, explore biography and background of theorist Nola J. Pender, review schooling, career history, applications, and career success of the theorist, review the components and concepts of the health promotion model, explore how the health promotion model is used and impacts nursing research, explore how the promotion model impacts nursing practice. So first off, just a little bit about Nola. She was born on August 16th, 1941 in Lansing, Michigan. She was born to parents who were advocates for education for women, which probably led to Nola's long time education history and all the success for her. She had a calling to nursing at just seven years old. She was at the hospital and she saw a bunch of nurses taking care of her aunt who was there. So after that, that experience led her to the desire to care for others, with her number one goal being that she just wanted to help people care for themselves. So some schooling, Nola, she studied at the School of Nursing and at West Suburban Hospital in Oak Park, Illinois. She received her diploma in 1962. In 1965, she received her master's degree in human growth and development from the same university. There, she had a focus on community health nursing as well. In 1969, she received her PhD in psychology and education. Her research there focused on developmental changes in the encoding process of short-term memory in children. So her career first started on a medical surgical unit. She then transferred to a pediatric unit, and continued on there for a little while. She taught, um, or she trained undergraduate and graduate levels, and also mentored postdoctoral candidates for 40 years at Michigan State. She directed several studies regarding her health promotion model with adolescents and adults, and she also developed a program called Girls on the Move, which encourages young people to perform active lifestyles. Just continuing on here, Nola, she wrote and issued several articles on exercise, behavior change, and relaxation training. She collaborated with nurse scientists throughout the entire world. You can see on the screen, the several places where she was able to communicate with them. So I'm sure she got a wide range of information on how, with health determinants and socioeconomic status and, all those different areas of concern for different countries. And she is known as a scholar, a presenter, a consultant, and a consultant in health promotion. So she was a member and a president at several places. So here is a list of all those. So she was the president of the Midwest Nursing Research Society, as well as the American Academy of Nursing. She was a member of the Research America's Board of Directors, as well as the U.S. Preventative Services Task Force. She was an associate dean for research at the University of Michigan School of Nursing, and she was the co-founder of the Midwest Research Society and has served there since 2009. So current career, where is she at now? So she presently is a professor emeritus at Michigan State University. After retirement, she will continue to devote a lot of her time as an advisor for health research nationally and internationally. She serves as a distinguished professor of nursing at Loyola University School of Nursing in Chicago. And she continues to share her knowledge and experiences to improve the nursing profession, um, as well as collaborates, with the American Journal of Health and Promotion editor, continuing to promote legislation to support health promotion research for the future generations. So her model is the health promotion model. Uh, Nola, she states that health promotion and disease prevention should focus on healthcare. Pender defines health as a positive dynamic state, not merely the absence of disease. And that's really unique because I feel like a lot of people just think of health in the absence of disease and think, oh, you're healthy if you don't have any disease, but there's so many other things that go into that. So that was unique. The model notes that each person has unique personal characteristics and life experiences that affect, their actions down the road and in their future. These variables, contain behavioral specific knowledge and effect that have importance on, the modified through nursing actions. Health promotion behavior is the desired behavioral outcome and is the endpoint in health promotion. So, can the behavior change due to the health promotion model and all of the characteristics that go into a behavioral change? So, here is a visual of the health promotion model. The model focuses on the following three major concepts. So, the first one is individual characteristics and experiences, behavior specific cognitions and effect, and behavioral outcomes. And in all of those become all of these extra sub concepts. And we will go over all of those right now. So on this page, we have personal factors, and these are the biological, psychological, and socioculture. Um, which I guess all three. So personal factors are the next three. So biological, psychological, and socioculture factors. They each stand for something significant. So biological factors are things such as age, gender, body mass, agility, balance. Psychological are the self-esteem, self-motivation, personal competence, health status, like their own personal perceived opinion about their health status and their definition of health. Social culture are things like race, ethnicity, education, and socioeconomic status. Perceived benefits of action. So this is the anticipated positive outcomes that occur from the health behavior. Um, Perceived barriers to action are the anticipated imagined or like the roadblocks and personal costs of understanding a given behavior. Perceived self-efficacy is the ability for someone to be capable of organizing and executing this behavior. So, those who have high levels of efficacy will have more uh, positive behavioral change. Next is activity related affect. So this is the subjective positive or negative feeling that occurs before, during, and following a behavior. Interpersonal influences. These are like cognitive, like our concerning behaviors, beliefs, or attitudes, our social norms that have impacted the way we live and our perceived health. And if we're able to move past those norms in order to change and become, more positive in our health. Situational influences. So this is, do we have options available to us? Do we have an environment in which supports the behavior change? Things like that. Commitment to the plan of action is like the intention and identification of a plan strategy. So, is there a commitment from a person to take the steps for the positive behavioral change? Um, Next is immediate, completing demands and preferences. So these are competing demands and competing preferences. So demands are the alternative behaviors over which um, individuals have low control because of the environment. Their demands such as a full-time job, 5 children in the home, all of their outside responsibilities that might affect their ability to change. And then the preferences are their ability to have control over something. So, say nutrition, are they able to, if they're craving ice cream, can they stop themselves and have an apple for a snack instead? Do they have control over their emotions when it comes to the behavioral change that's needed? Health promoting behavior, that's like I talked about before, that's the end point and the action, like the outcome that we want by using this model. So, are we attaining positive health outcomes and well-being, personal fulfillment, and are they able to be productive in this new change? So, those were the concepts. Now, we're going to talk about how the health promotion model is significant in nursing research. So, the model is used to explain all of the underlying factors towards the motivation to engage in health promoting behaviors. Also focuses on the interactions with people's physical and interpersonal environments during attempts to improve their health. So looking within, looking, at their integrity, at their, cognitive function, are they able to, um, do that change? So with research, the health promotion model can be used in quasi-experimental studies, cohort studies, pilot studies, or randomized control trials to determine the effectiveness for any health promotion activity. So, some examples here are a quasi experimental study where they use the model to look at improvement of nutritional behavior in overweight and obese women. There's an experimental study on the quality of life and health promotion in patients with heart failure using the model. And then there's a randomized control trial using the model on the quality of life and stress management, self efficacy of patients with multiple sclerosis. So that's kind of how you can use this model in order to do research to find correlations to see if it improves the health, by looking at the entire body, from the inside out. How does the health promotion model impact nursing practice? So it's used in practice for education and counseling programs to promote health. Some examples are physical activity. You could see this in like a rehabilitation center, where at their discharge, they're promoting that, they continue to move their bodies. You have improved nutrition. So, say someone just got a gastric bypass surgery, that's not the end all be all. They actually have to change, their prior habits in order to see long-term effects. So using that in nursing practice, reduction in tobacco, alcohol, and drug use, stress management, sleep hygiene, and healthy relationships. So in nursing practice, you can use the health model to encourage, at the end when you're discharging your patients or during their time when you're doing that nursing education for any specific condition, using those health promotion tactics to help them be confident and understanding who they are, what they need to do to change, to continue to live a lifestyle that is healthful for their well-being. So overview, Nola, she played a significant role in research knowledge surrounding health promotion and disease prevention. She continues to use her unique skill set and talents to educate the new generation of nurses and other healthcare professionals. The model, it looks at the overall behavioral patterns of a person's motivation to change, as well as their interactions with their physical and interpersonal environments. So those interpersonal and physical environments, you look at those and you assess them and try to understand if certain aspects of that will positively or negatively affect their health, and then be able to see that and talk about it and, help them through those things. Um, this model, in research can be used to prevent and treat chronic health conditions, and should definitely be utilized when examining the impact of, a certain health promotion technique and its intended health concern. So this is a super, super positive theory done by a very, well announced um, professor, nurse. She's great. So that's all I have. Here are my references.